Matters arising with Nelomma.
Hello everyone, welcome to Matters Arising Around the Globe with Nelomma. Today in our Matters Arising, we have different stories, different news, different breaking news coming to you around the globe. And first is about the US, the United States of America. Wow! They have returned a whopping sum of $312 million. Did you hear this? A whopping sum of $312 million looted by our own former president, though late, Abacha. This money was looted by him to the USA, and now it has been returned to our now sitting president, Buhari. How about this? Somebody who says he is a man of the people. Let's not talk about Abacha. Now look at Asari Dokubo. We all know how controversial he is. Now he has come out to say he is in the side of Governor Yesowike of Rivers State, claiming that his people are... What did I just say? Just hear it.
We too mumu. Sometimes our mumu they smell bad. Every time we like to show our mumu. Now for this COVID-19 matter, now I see how mumu will be. Wike say the money we then give other people, may then give us too. We say, hey, all the things that we can do, they close market, they close church, now because of money.
Oh yeah? Now he's on his side, unlike before, like you heard him say. And they should give them money since Buhari has used his... Did you hear that? Say it.
Oh. So Buhari fit put in hand, in leprosy finger, inside our vault, carry 10 billion, give Lagos.
So funny. Can you imagine our president with such a finger? Okay, let us look at Atiku. On a workers' day, he sacked 46 workers. Wow, what a wonderful workers' day. In fact, everything is so dangling up and down. I don't even know what to say. At the end of the day, he said he doesn't know about it, that it is something that has been on ground since 2019. They've been on review. And finally, he chose to sack them on a workers' day amidst this COVID-19. Is it not funny? Is it not surprising? At the end of the day, they said they paid them all their disengagement funds. So funny. Now the strange death in Kano. Not one, not two, not 100. In fact, now it has been targeted at journalists. Not me anyway, because it can never be me. And the Emirs. Somehow this means that they offended the gods by dethroning their emir the way he was dethroned. And others said that it was as a result of this so-called China vaccines that is bringing this kind of calamity, this kind of tragedy to the people of Kano State. They said they have desecrated their lands. Okay, and it's not funny anyway. This is absolutely not funny. Something has to be done. Finally, our Nigerian lawyers have woken up. They plan, listen to me, I said they plan to sue China of 77 trillion naira as regards to the damages being caused by China because of not being able to contain this particular disease. You all know the disease we're talking about that has eaten the whole world up. And now China came out to say, no, they should not be sued because the disease is a common enemy to mankind. What do you have to say? Note, they have not sued yet. They plan to sue. And China, they are already defending themselves, claiming that is a common enemy to mankind. Remember, I keep talking about this. We should all rise up and say something. We should not let Chinese or the China people go scot-free for putting us through this pain. Thanks to God that the Nigerian lawyers are now out for this, though we've not heard that they've sued, neither have they paid the money yet, and China's, they are already defending themselves. And then we talk about the leaked presidential speech. Do you remember the day the president was supposed to address his people? And 4 hours before the address, we already had the written note about the speech all over the social media. And surprisingly, it was the same speech we had at 4. That was the same thing delivered to us by our president. And they said they have finally caught the person who leaked this speech. This is so funny. I don't know if we were to say is a live speech, is a live delivery, or something else. But that's by the way. What I want to talk about here is that Nigeria has grown. Now they have technology, good technology that can actually track people this much. Kudos, that's beautiful. And because they said the same so-called person was caught same evening after the speech was being delivered. That's beautiful, isn't it? Another question I want to ask the general public, Nigerian government, and the people at large. They have relaxed the lockdown, right? So what's the sense of the lockdown in the first place? When they imposed the lockdown on us, we never had this number of cases about the COVID-19, and now they've relaxed it. What did we achieve with the lockdown? My people, can somebody just tell me what we achieved with the lockdown? Did we just lock down that other countries are locking down? Why on earth did we lock down in the first place? Because in as far as I'm concerned, nothing was achieved. And now that the virus is almost everywhere, I've lost count. I'm hearing 2,000 plus, almost 3,000. I've lost count. And these people relaxed this lockdown. For crying out loud, what is the essence? It's not even as if we were giving anything to help shield us from this virus. Neither do we even have this imposement, although I've heard that the federal government has imposed mask, be it fabric mask, anything mask on the citizen. I just don't understand. Why didn't they impose this earlier before now? Why did they lock down in the first place? Now, after imposing these face masks and all that, federal government said that if you are caught without face masks, you'll be prosecuted. That's so funny. Why wasn't this? I just cannot place this too. I can't place the relaxing of the lockdown when it wasn't even called for. And now they said if you are caught without anything face mask, quote me, without anything face mask, they don't even care if it actually prevents this disease or not. Although they said people will be persecuted. I urge you guys, please do not ever go out without your face masked. Okay, and this painful one is about our health workers, the doctors. How on earth would about 113 doctors test positive to this virus? 113 doctors. We have not counted the nurses. We have not counted other health workers. What are we doing? What are we doing in this country, for crying out loud? And a man spoke up with a very good proposal about the kind of hospital they want to build in a certain town in Nigeria, in Abuja, around the... Just listen to him.
Hello guys, this is the beginning of a series that catalogs my experience and the experience of others with government over the years on different initiatives that will have benefited Nigeria and Nigerians. The first episode in this series will talk about my experience in trying to get the Jonathan government to do something about the healthcare sector. Sometime in early 2013, I had put together an international consortium to design, finance and construct a 1,687-bed hospital facility to be known as the Abuja Medical City. As part of this project, we were to upgrade and equip all the government hospitals in Nigeria also. A similar project was being done by members of this same consortium in Ghana at that time, and is now fully completed.
Wow, what a beautiful proposal. And what finally happened?
The project was to be financed with a US Exim loan, which we were to source for the federal government under Goodluck Jonathan. In February of that year, my team and I presented this project to the then Minister of Health, Professor Onyebuchi Chukwu. The Senate Committee on Health, then headed by Senator Dr. Ifeanyi Okowa, who is currently the governor of Delta State. We initiated discussions with Johns Hopkins Hospital Management to manage the proposed mega facility. And like I said earlier, financing was to be provided to the federal government of Nigeria. At the end of the presentation, the minister whispered in my ears in Igbo language and said, "Do you have access to the president? That's the only way this can fly."
Did you hear that? He was whispered to speak to our vulnerable president in the person of President Goodluck Jonathan.
Guys, that was the end of Abuja Medical City. Just imagine that a minister who is the representative of the president in that particular ministry was asking us if we had access to the president he works for. Now, this was even President Jonathan, who to all intents and purposes was docile and approachable. His own minister was asking me to use my connections to get to him. What do you think happens now with a president who has clearly told his ministers not to bother seeing him at all, but see his chief of staff? Anyways, after wasting a few $1 million in design and engineering fees, we had to pack this project as it was clear that the Nigerian government was only paying lip service to this sector. Please fast forward to the present day and tell me if this project had been executed then, if we wouldn't be in a better position to even start addressing this pandemic. Now they are busy installing Chinese tents all over the place as isolation centers and claiming they are getting something done. The countries we have seen creating huge isolation centers have thousands of fully equipped and properly functioning hospitals that are now overloaded. So they are creating isolation centers for the overflow. In our case, we go straight to the easy option of installing a makeshift isolation center and shamelessly send videos of these tents around to show we are working. China built a hospital in weeks to address this crisis. Watching Boris Johnson being wheeled out of the ICU in a London hospital and seeing the medical personnel clap for him got me emotional. British doctors treating their prime minister in a British hospital. Our own president was in a British hospital for months, and after he came back, did not see it as an opportunity to declare a state of emergency in our healthcare sector. In the same hospital he was treated, you probably had Nigerians as their top experts in different fields of medicine. The same Nigerian doctors and healthcare professionals who couldn't thrive in their own country. Please, wake up and smell the coffee. You need to build hospitals very fast before we run out of time. The hospitals will endure beyond the crisis and will serve all of us. But if you make a tent your hospitals, just know that chances are that you or a member of your family will at some point need a properly equipped hospital during this crisis. And you or they will likely end up in your makeshift tent. Thank you.
Did you hear that? He said not to talk of our now sitting president that does not even allow his ministers to come close to him, to talk to him. He rather directs the ministers to speak with his chief of staff. Unlike the then president that is very, very, very accommodating. And now I want to come to you, Mr. President. You have been going out from one country to the other speaking for medical attention. You're seeking for medical attention elsewhere when everything you have is in here. And most people that gives you this attention are still people from Nigeria, doctors from Nigeria. Can't you make use of your common sense? Can't you make use of your sense to know that the only thing you owe this country is a good infrastructure, just like this proposal? Just take a look at this proposal, my people. Just look.
Please watch the presentation we made to him, and I will tell you the outcome of the presentation at the end of this short video.
A compromise with the people of Nigeria. Abuja Medical City. Abuja Medical City will be the first level 3 medical care facility in the region, offering high-quality attention, meeting today and tomorrow's healthcare needs. Conveniently located directly off the main highway that connects the city of Abuja and its airport, the hospital is located at the center of a thriving development Industrial zones will provide space for light manufacturing, such as medical equipment and pharmaceutical storage. Commercially zoned areas for office space, shopping, hotels, and related medical and commercial services will provide support for the hospital. Green spaces are at the heart of Abuja Medical City. A long linear eco park provides open green spaces to all areas of the neighborhood. Police and fire facilities will be available to ensure public safety and prompt service. An optional transportation station will act as a central location for buses, taxis, and other transportation services. Multiple religious facilities are located in Abuja Medical City for the convenience of residents and all visitors. Medical school and research facilities will work closely with the hospital. The Abuja Medical City complex will include inpatient hospitalization, ambulatory care, support services, parking, and utilities. High, mid, and low-density residential areas will provide high-quality housing for doctors, medical professionals, and students working and studying at the hospital facilities. A school is also conveniently located within the complex, next to the residential areas and the eco park. A number of medical facilities comprise Abuja Medical City, Nigeria's first Level 1 trauma center, a specialty hospital, pediatric hospital, maternal and newborn institute, ambulatory care center, physiotherapy and rehabilitation institute, and an amenities care pavilion. Abuja Medical City counts on 1,687 beds, distributed throughout the general and specialized areas of the hospital complex. The architectural design reinforces the commitment to be a sustainable, functional, comfortable, and efficient medical facility and center for knowledge. Waiting areas include large windows to bring in natural light and create warm, natural, and pleasant interior spaces. Interior gardens facilitate pedestrian circulation and encourage social interaction. Specialized pediatric care is available at the pediatric hospital, where a team of medical professionals can provide advanced specialty care. An easily accessible central services building hosts the core services, as well as common support departments, such as surgery, sterilization, and diagnostic imaging, among others. The facilities will be equipped with the highest quality equipment for departments, comfortable single and double occupancy dormitories. VIP dormitories offer patients large rooms with exclusive access and unparalleled privacy. A variety of beautiful and calming therapeutic gardens will be available to meet the physical and psychological needs of patients and families, while reducing stress and improving healing. The optional public transportation facility will provide a centralized bus and taxi station. A hospital of the future. Abuja Medical City. A project of innovation in design, durability, and technology. Equipped and designed for the healthcare needs of the people of Nigeria.
Isn't this beautiful? Isn't this awesome? Is this not what we need in this country? And the worst part of it is that this proposal is not even to be funded by the Nigerian government, according to him. All he needs is an approval. He needs them to approve this and it will be carried out. But nobody said a word. Rather, they go about building these tents, canopies everywhere. in the name of isolation center. Just look at what happened to Kogi. Kogi's isolation center. What do you have to say about this? And it scattered, just a little breeze. And this is something that they spent trillions, millions, billions of naira to build. Instead of us waking up to know what to do at every point in time. Who has done this to us? Who has done this to Nigerians? And China's are importing this mess to us in the name of an isolation camp, an isolation tent. So this is what we now have the money to do, to build this trash. Instead of building a very good infrastructure like this, just take a look at this, take a look at this. Now we have nothing. We have nothing to show for. We have nothing to take care of us. And it pains me so bitter. I'm so bitter that this thing is affecting our health workers. If I am one, I would resign. I would rather go home and die. Because the government is not taking care of them, is not even providing anything for their safety. What then are they working for? They will contact this virus, come back home and spread this round to the people they feel they are working for. It is not fair. And look at our controversial ex-senator in the person of Dino Melaye. Did you see what he did?
When are you doing? Happy. I stay for house. Eh? This thing, I know say na food might be fine. It is hard. But it could make me stay for house.
Stay for house, I want to just check. I want to wait for it. We ourselves, we want to get it. Our children. They will not feel there and they don't have I said, if you go bed, you know the feel yourself.
Yes. Did you listen to this woman? And you asked her to go inside. To sit at home doing what? What do you want her to do with these kids?
You as a mother, if children cry like 2 or 3 children, so I put you again, if you go bed, you know the feel it. Then me, I can bear it. Then the little children can't bear it. That's the way to, and this thing will succeed. Manage our life. Those not if not, nobody will not be sharing. If there's sickness. If you now say if somebody stop, and I mean the first fear.
She cannot sit and watch them cry. Of course.
Nobody will not be sharing.
Of course.
If there's sickness.
She
If you now say if somebody stop, and I mean the first fear.
I want to use this point to point out to those of you who do audio donation. That is what we call it. This money you donate millions, billions to the federal government, all in the name of politics. You want your name to be heard. You want to be recognized. Where has your conscience gone to? You don't have conscience. If you do, you wouldn't have given this to the federal government. You know what to do. You know how to share it. You know how to share this money. But no, you want to be recognized. That's why you gave it to the federal government. And what happened? Nobody saw it. It wasn't used for anything. People died in the name of lockdown. People became more sick. Sickness that is not even COVID-19. Out of hunger. And you are there claiming you donated money. That aside. And the little things that are being shared to people, they were all meant for the indigenes. In a community or another community, you hear, oh, if you're not an indigene, you have nothing to gain. And my question is, and I ask again, why didn't you ask people to go back to their various homes, to their various communities, to their various villages? Since the incentives we were to share are meant for the indigenes, you should have asked everybody to go home. And now look at it. Finally, you shared just for the indigenes, those peanuts, those little things you were able to share. That aside. And now look at the US president. He shared $1,200 to everybody and asked them to sit at home. $1,200. And guess what? It wasn't shared for the Americans alone. See our Nigerian people who had testimonies about how they were also giving. They were also recognized. We are not talking of just Africans. We're not talking of just Americans. We're not talking of Asian or other countries. We're talking of our own, our Nigerians, our brothers, our sisters. They collected their own money, including people that were banned from coming to the country. But in their accounts, they received their alerts. And this is what we call fair and free. Very fair. We can never be this fair in this country. And I don't know why. I don't know why we are so greedy. Why are we greedy in this country? And now I heard that the United States FDA has approved the Ebola drugs for the treatment of coronavirus. I don't know how true this is, but I hope it is true. Though they claim that it is not really a pure cure for the coronavirus, that is a slow process. And I said, at all, naim bad pass. So I am ending this Matters Arising here for today. And guys, stay safe. Like I always say, please, even though they have lifted the lockdown, it is not a yardstick for you not to be safe. Please stay safe, stay secure, stay home if you can, and be careful. See you in the next episode of Matters Arising. I still remain your girl, Nelomma. See you guys. Bye.